Hi, I'm Sally Duplantier, founder of Zing, and today I'm joined by Annie Fenn, who is the founder of the Brain Health Kitchen. Hi, Annie.
Hi, Sally. Thanks for having me.
Yeah, I'm so excited to talk to you today because what we're going to do is take a look at a recent clinical trial done by the Rush Medical Center research team about the MIND diet.
Yeah.
So let's talk about that because I think some of the results were surprising. But first of all, what is the MIND diet?
Well, the study that was just published in the New England Journal of Medicine was the MIND Diet trial. So this is basically a part two of the MIND Diet study that was published back in 2015. This was the much awaited randomized controlled trial of the MIND diet. So we probably should go back to 2015 and take, a quick look at what that study was all about. And then we can understand better, what the MIND Diet trial was trying to show as well.
That sounds good. So let's start with 2015. Tell us about that trial?
So the MIND diet is actually a dietary pattern that is a spin-off of the Mediterranean diet and the DASH diet. And it was thought of by Dr. Martha Claire Morris, who was the lead researcher on that paper at Rush University, and her colleagues. So Dr. Martha Claire asked the question, so we know that the Mediterranean diet has so many health protective benefits, right? Like we know that heart attack risk goes down, stroke risk goes down. And then back then, there were also studies showing that dementia went down, longevity went up, things like that. So Martha Claire asked the question, what if you take the Mediterranean diet and you make it more brain specific by including certain food groups? Now, she had been studying brain healthy food groups for 20 years at this point as a nutritional epidemiologist. This was her specialty. So she had studied berries, she had published papers on leafy greens, looking at people's brains on MRI, showing that the more salads they ate in a month, the better their brain volume got over time. She'd done a lot of work along those lines already. So she wanted to apply that to the Mediterranean diet to come up with a dietary pattern that could be followed easily, enjoyably, to help people reduce their risk of age-related cognitive decline.
So, and in fact, Dr. Gardner, Christopher Gardner out of Stanford, we did a paper relating to neuroprotective diets and cognitive decline, and we cited that original paper in our research. So,
Yes, yes.
so the results were pretty remarkable with the initial round of research. Just say a little bit more about those initial results.
Exactly. So what they did, they took about 850 people from the greater Chicago area. This is a cohort of people they've been following in lots of different dementia-related studies. They followed them for 4.5 years. Now, to get into the study, you had to be cognitively healthy, meaning they were already screened for dementia and were not found to have a dementia at the onset of the study. Because what they wanted to see at the end of 4.5 years was, based on their eating patterns, who was more likely to get dementia or Alzheimer's than others. They also wanted to look at their cognitive function, see if they could boost it by eating more brain healthy foods. So they take over 800 people, they follow them for 4.5 years. They come up with a MIND diet score, which is based on the 10 brain healthy food groups and 5 food groups to limit or avoid. And 14 is the highest you can get. So if you're a really good brain healthy eater, you score 14. And what they found at the end of the study is that people that scored closest to 14, they had 53% lesser chance of getting Alzheimer's at the end of just 4.5 years.
So that's a pretty remarkable number. And yet that was an observational study, which, as we know, shows correlation, not causation, because we don't know what else might have contributed to it, although in the statistics, they account for that. But now fast forward to the article, that the study that was just published in the New England Journal of Medicine, because that was a clinical trial with the
Yes, yes.
same
So
researchers.
when I spoke to Dr. Martha Claire Morris back in 2015, when the first paper came out, she was already planning this trial because she very, very well knew more than anyone else that this is an observational trial. Even though the findings are astounding for any kind of a food or intervention trial revolving dementia, think about it. Up to that point, we still have no drug, no intervention, nothing that would reduce someone's dementia by 50%
Right.
or more. So she had already planned to do a randomized control trial. And what ended up being the trial was what she was thinking of back then. It was taking a group of people, have them on the MIND diet, give them support so that they can follow the diet and follow it well, and then have a control group. And both groups, it's almost impossible to, blind them, which would be optimal in a study like this, because they're getting cognitive testing, they're doing dietary questionnaires. Everyone in the study knows that they're looking at nutrition in the brain, right?
Right.
So it can't be completely blinded, but they also don't know exactly what the study is about. And so they added a weight loss component to it, where both the control group and the MIND diet group would be on diets that are less in calories by about 250 calories each.
So in other words, one group is on the MIND diet, one group is in the control, but both groups are encouraged to lose weight. Am I correct with that?
Exactly. And this is the rub.
Yes.
And this is different than the original MIND diet study. This population was overweight. They had average of, BMI of somewhere between 25 and 35, which is considered obese. So this could have been looked at as a weight loss intervention trial with a MIND diet component.
Yeah, it's interesting because I'm already starting to see certain similarities between the MIND diet group and the control group, which may make it more difficult to see clear-cut results. And that's a little bit of what happened.
And another thing that's really important to note here is that everyone in the study had a first-degree relative with dementia or Alzheimer's, unlike the diet trial. So this is a particularly at-risk group.
Okay.
A lot of them had diabetes, 75% of them had hypertension, 50% have high blood pressure. There are a lot of diabetics in the group.
And all of those are risk factors for Alzheimer's. Yeah.
Exactly. So what we're doing here is we're not taking like an average group of people who are middle and older ages and following them. We're taking a group of people who are particularly high risk for Alzheimer's and putting them on a weight reduction diet and seeing how they do.
Yes.
Really
okay. So it is interesting. So tell us the headline. What were the results? And then we're going to dive in a little bit deeper because the results were kind of surprising.
Yeah, the results were kind of surprising. And I have to say the study is a little bit nuanced to understand. It doesn't have a big headline like Alzheimer's risk was reduced by 53%. It doesn't have anything like that. You really have to dig into the guts of the study to understand what's going on. So basically what they did was they followed them with dietary questionnaires, which was basically the MIND diet, but they didn't address alcohol in this one. They dropped that as a brain healthy food group. They did a battery of 12 different cognitive tests. They did brain imaging by MRI at the beginning of the study and 18 months later, which is very powerful. And they also checked their blood for antioxidants of certain things like carotenoids. And that was more to just prove that they actually were following, a healthy diet. So the big news is that both groups got healthier. Everyone did really well. I mean, they actually lost more weight than is typical in a weight loss reduction study. Each group lost about 5 kilograms or 11 pounds, which is
over a period of about 3 years. Am I correct?
In 3 years, exactly. Everyone did better on their cognition scores. Okay. And there's some details here that we can go into as well, but everyone was really actually improving in their cognition scores. We saw that in the original MIND diet study. Not only did people have a lower risk of Alzheimer's at the end of the study, their cognition was like going up. They were actually getting, sharper, and they're doing better on their memory tests and their executive function and all of those things.
Which is, so that's amazing. And yet, if we were to design a clinical trial, usually what we would want is a clear-cut difference between the intervention group and the control group. So you really dug into the results of the study, and I know you've talked to some of the authors. Why do you think, why do you think we had these findings?
Well, I think that at the end of the day, it doesn't show that the MIND diet outperformed the control group. And that was the big surprise. So a lot of people are calling this, maybe a failed study or a disappointing study from a MIND diet perspective. But actually, there's so much here to be learned. And the MIND diet group was actually starting to break away cognition-wise from the control group at the 2-year period. You really have to look into the supplemental material of the paper to see that. And you have to understand that at the 2-year period in the study is when the global pandemic hit. And so the study went on hiatus. They were no longer in person. They saw everyone's cognitive scores start to drop across the board. A lot of their elderly constituents in the study were fearful of going out. The study groups were in Boston and Chicago, and there's, people were even afraid to go to the grocery store. And so I think that what we were just starting to see is a breakaway in the MIND diet group over the control group. But everyone is improving. And that's actually like the best headline that we can have, is that following a healthy diet and also being in a community that talks about healthy cooking and healthy living is really powerful for improving cognition as people get older.
Yeah, I would agree with that. And I thought what was interesting with the control group is that even though they weren't given like specific foods to eat, they knew they were part of the study. They were encouraged to lose weight. They were encouraged to cut 250 calories out of their diet a day. So in some ways, they were doing their own intervention, which was a little bit harder to mention.
It's true. And also the community part of this, I didn't understand what sort of a community Rush was building with this group of participants until I talked to Dr. Tom Holland about it. And they had many meetings every year as a community, like cooking classes from the MIND diet and other types of interventions like that. And so whenever you're part of a healthy community of people who are getting older and trying to be healthier, the people that want to be in these studies are actually interested in being healthier too. And so that control group, I was really rooting for them too. And I'm sure everyone at Rush was as well. So it really is kind of a win-win situation here.
Yeah, I would agree. So to wrap it up, let's just talk about one or two key takeaways. What would you like people to remember, Annie, about nutrition and brain health?
Well, across the board, when you look at the MIND diet or the Mediterranean diet or the green med diet, or there's a handful of other brain protective dietary patterns, cognitive scores go up when people start to implement this type of eating.
Yes, yes. And that's what we found. So Dr. Gardner and I looked at, I think, 42 different studies. And what we found was that the overall dietary patterns that are associated with reduced risk of heart disease and other vascular disease are also associated with reduced dementia. So
Yeah.
healthy eating makes a difference in terms of our overall health, including brain health.
It really does. And I think the number two big picture item is that there's more than one brain protective dietary pattern. I wrote my book not just for people who are vegetarian or vegan or follow a MIND diet or follow a Mediterranean diet or a pescatarian. I wrote it for everyone because there's commonalities in the recommendations for brain healthy eating that you can apply to whatever dietary pattern you choose to follow because you like to eat that way and it's part of who you are. So there's not just one perfect way to eat a brain healthy diet. There's lots of different ways, can be applied to lots of different ethnic groups, lots of different ages, and lots of different proclivities of the way we eat.
And that is a great takeaway. Annie, thank you so much for participating in today's interview. I love your newsletters, and I look forward to continuing to learn from you about brain health.
Thanks, Sally. Fun to talk about the MIND diet with you.
Have a good day.
You too.